Computer Block in Orlando at the AHA annual meeting. With me is Dwight Reynolds from the University of Oklahoma. Dwight has been the PI of this micro pacemaker implantation business that everybody has been talking about for a while. So Dwight, tell me about the study. This is exciting new work.
Thank you very much. This is a first-in-man study. We have implanted in a non-randomized trial 725 patients. Success rate for implant of this small, less than 1 cc, 2-gram device. 719 patients, success rate 99.2%. We looked at it in comparison to a historical data set, compared our endpoints were a safety endpoint, which was freedom from major complications. And we looked at an efficacy endpoint, which was low and stable pacing thresholds at 6 months.
Well, that sounds very exciting. This is brand new technology, transvenous implantation from the groin, big sheath, but in fact the sheath comes out and then you're just left with this little piece of metal at the apex of the right ventricle. Tell me about failures. Have you had any that have failed in this trial?
We've had minimal failures, and we had no dislodgements and no infections in the trial. We were really kind of surprised by the absence of the dislodgements in particular, but especially the infections is a big thing.
Well, that's all good news. One of the questions that everybody obviously is going to ask is how much does this cost compared to a standard pacer?
The prices I don't believe have been set. That'll be up to the company Medtronic to decide, but I can't speak to that.
Okay, so I guess the question is, this is exciting news. Question to you is, if you needed a pacemaker, I certainly hope you don't, but if you needed one tomorrow, what would you choose? Would you choose this little RV implantable and no wires, or would you go to the standard, well-proven technology?
That's a great question. The Micra, the leadless pacemakers, I think are primarily designed to avoid the major problems that we have with lead-based pacing today, specifically infections, pocket problems, and then the veins, the venous access. So I think to answer your question, if I needed a VVI pacemaker, a ventricular-only pacemaker, which this is, I would clearly be in favor of having the Micra implanted.
So there you go, brand new technology, very exciting for patients that need a VVI. This sounds like a great technology, but like all things, nothing is forever or perfect, and so it's still up to the doc to decide what's best for his patients.
It is. You're absolutely correct. We don't think this is going to supplant the traditional pacing system in the current iteration.
Thank you.